Global Parents for Eczema Research, or GPER, is an organization founded by parents on the belief that children with eczema deserve a better future, that the status quo isn't good enough, and that parents and patients can help lead the way to better treatments, medical care, and even prevention strategies. That's been our guiding star ever since, and it's never changed. So what does it mean for parents and patients to be at the center of these key areas that we work in: research, policy, and family support?
It means faster progress towards finding a cure.
The patient and parent voices' influence on eczema research is really about trying to get to root causes and prevention.
There are information that only the parents or the patient know.
Eczema is almost entirely managed in the home, outside of the view of researchers and healthcare professionals. In trying to figure out triggers and reasons for the eczema, parents and patients make observations and have unique insights that could potentially inform research. But their wisdom is currently untapped. That's why we launched the Big Ideas for Eczema Challenge, a global competition to solicit and reward patients and caregivers' ideas for research. And we were blown away by the response.
I was, doing so much research in the background when my son was really suffering. It was kind of my coping mechanism. So if I was laying next to him, and obviously he would not be sleeping well, and I would kind of be rubbing him with one hand and then searching and reading anything and everything with my other hand, and taking so many notes and having so much of this in my headspace. I sometimes would call it like brain soup, because I just have so many pieces of information. This type of challenge encourages me, or it challenges me to, do something with that. And that feels useful and beneficial.
I think a lot of people who have eczema, or maybe who have children with eczema, are doing this kind of private research in their own house and just obsessing over it maybe. So just the idea of like a project or competition like this, where that private research can then go out into the world and help more people than just like yourself or your family, is pretty cool.
The GPER community, you guys really inspire me. The level of intellectual curiosity in the group. If you have that intellectual curiosity, you just can't help but try to connect the dots.
What do people with eczema in the United States have in common with those in other countries? It turns out a lot. That's why we invited 14 eczema patient organizations from all over the world to join us in establishing metrics to gauge how patients are faring in 11 countries, and to collect data to track progress over time. Together, we prioritize the elements of healthcare provision that matter most to patients and caregivers, and developed indicators with which to measure them across diverse nations. Now we're working together with one voice to advocate for improvements for people with eczema everywhere.
This was a really innovative initiative to bring together like-minded organizations to help articulate what is missing for patients across a bunch of different countries. The solidarity with all of the groups involved in this is really meaningful.
It's fantastic to have these international insights and to understand what works well elsewhere. So it's been a fantastic international collaboration and a really positive initiative.
I think one of the biggest things we've learned through this initiative is that there's a huge opportunity to improve medical care simply by involving patients and caregivers in their medical care.
We're never going to really know how to effectively treat eczema patients unless we have constant communication with parents and patients about their perceptions of the treatments, as well as some of the drawbacks of the treatments out there.
The first step for improving medical care, especially for children with eczema who don't have that voice, is look to the caregivers, look to the families and parents as a part of that team. Empower them, equip them with the knowledge and skills that they need to make those decisions, because we're the ones that take them home at the end of the day.
If there's one area where patients and caregivers absolutely need a seat at the table, it's in clinical practice guideline development. These guidelines are usually written by physicians and shape medical care for people with eczema for years to come. Given that childhood eczema is largely managed at home, is different from person to person, and treatment depends on the capacity, opinions, and realities of families' lives, guidelines must include patients and parents.
GPER has fought really hard for putting patient or caregiver voices on guideline boards. It's very easy to say everybody should take this medication without a real conversation about what does real world use, what the real world costs look like.
I think one of the most empowering and inspiring areas of our work has been the Support for Eczema Caregivers program, where we saw that caregivers were really in distress and battling depression and anxiety. And we were able to come up with a program where we tapped the support network of other parents to create a program that filled that need.
You know, it's one of the hardest parts of being a dermatologist is being slotted to take care of patients with eczema and check in on them for 15 or 20 minutes maximum. And what we really need is something outside of the clinic that's going to allow for patients to connect with each other. For me, Jeeper is really filling that gap in a novel way.
The purpose of the program is to bring together families who are feeling alone and match them with someone who knows what it's like to walk that road. And so in that way, we're creating community and giving connection and support, but also providing evidence-based resources for these families.
And I'm glad that my mom has something that has people that can be there for her, has people that understand the struggle that she went through, and she could actually be able to help people who are newly going through this.
You know, once I started to find my rhythm, I saw a call for mentors, and I was like, hey, you know, this was so hard for me. I would have loved a mentor earlier in this experience, in this process. And now that I feel like I've gotten to a better place, I'd love to turn around and support other folks in this really difficult journey.
Today, this particular group of parents, they are fighting for the other parents.
I think it's time for us to lead.
I am an eczema parent.
I am an eczema parent.
I am an eczema patient.
And we are the voices
driving change
for eczema.